What mobility limitations can synovectomy rehabilitation cause for RA? Imagine undergoing a procedure to help your joints feel better, but then facing new challenges in moving as freely as before. Synovectomy is a surgical treatment that removes inflamed synovial tissue in rheumatoid arthritis to reduce pain and joint damage. While it can be helpful, the recovery process can sometimes lead to certain mobility limitations. One common issue is restricted range of motion. After synovectomy, especially when the surgery is open rather than minimally invasive, scar tissue can form during healing. This scar tissue can cause joint stiffness, making it harder to bend or straighten the affected joint fully. Inflammation or fibrosis after surgery can also contribute to this stiffness, which might reduce flexibility and limit daily movements. Another potential problem is a decline in joint function. Some studies have shown that synovectomy, particularly when combined with procedures like total knee replacement, may not always improve function. In fact, some patients find that their ability to stand, bend, or get in and out of bed can worsen after surgery. This can be especially true if the joint has sustained long-term damage from rheumatoid arthritis, making full recovery more difficult. Rehabilitation can be challenging, especially for those with a long history of rheumatoid arthritis. Early physical therapy focusing on passive and assisted active movements can help maintain mobility. However, patients who have had the disease for many years often experience less benefit from synovectomy and rehab because their joints may already be significantly damaged. This ongoing damage can limit how much mobility can be regained. There is also a risk of the inflammation coming back. Arthroscopic synovectomy, which is less invasive, sometimes has a higher chance of the synovitis returning. When inflammation recurs, it can cause ongoing joint swelling and stiffness, which further limits movement. This can slow down or even undo the progress made during rehabilitation. In some cases, nerve injury can occur during arthroscopic synovectomy. While this procedure is less invasive, nerve damage can affect how well the joint functions afterward. Over time, even if initial improvements are seen, mobility might decline again if inflammation or nerve issues develop, sometimes leading to the need for further surgery like joint replacement. Muscle weakness is another factor that can limit mobility after surgery. The inflammation and pain associated with rheumatoid arthritis, combined with the trauma of surgery, can delay muscle recovery. Weak muscles around the joint can cause instability and reduce overall mobility, making everyday activities more difficult and prolonging the time needed to regain full function. In summary, while synovectomy can help reduce inflammation and pain, the rehabilitation process can sometimes cause mobility limitations. These include joint stiffness, reduced range of motion, difficulty with daily activities, and the possibility of inflammation returning. The specific impact depends on the surgical method used, how long the person has had rheumatoid arthritis, and how well the rehabilitation is managed. Early and carefully planned rehab can help minimize these limitations and support better joint function. Always consult with a healthcare professional to develop a personalized plan suited to your needs.